With this beautiful weather the past couple of days, you might start to notice your seasonal allergies are really starting to kick in. But don't get those symptoms confused with COVID-19. Our Catherine Merck spoke with our local healthcare experts about monitoring your symptoms properly, even with these eased COVID restrictions. Catherine.
Well, Eric, 1 in 4 adults and nearly 1 in 5 children have a diagnosed seasonal allergy. With that many people who could feel symptoms similar to those of COVID-19, it's important to know the differences to make sure those symptoms aren't something more serious.
A lot of people have kind of moved on from COVID and have not wanted to think that symptoms could be due to COVID.
Friday marks a landmark in the COVID-19 pandemic. It was announced that on May 11th, the nation's COVID-19 public health emergency will officially expire. The CDC deputy director says that doesn't mean COVID is gone for good.
Does this at all change how the American public should treat COVID?
COVID-19 remains a risk, even though the public health emergency is coming to a close, especially for Americans who are immune compromised.
The move comes at a time when many people feel their allergies are at a peak.
Unfortunately, there's a large crossover between symptoms of COVID and spring allergy.
Dr. Mark Moss is an allergist at UW Health. He says even though some variants of COVID have symptoms similar to allergies, there are some differences and signs that you might need a COVID test.
Allergies don't cause people to have fevers, chills, body aches, or in general, extreme fatigue. Those symptoms would highly suggest viral infections such as COVID.
So on these days with spring-like temperatures, make sure to monitor your symptoms to avoid the virus from the 3-year health emergency.
And if your symptoms are particularly severe on days where it's warm and sunny and we've got a nice southerly breeze, your symptoms are more likely to be due to allergy.
So to avoid those seasonal allergy symptoms while you're outside, Dr. Moss says to wear a pollen mask while mowing the lawn or weeding the yard. He also says people with allergies should also avoid hanging clothes out and sheets outside to dry.